Hello, and welcome back to Earthy Cures News. If you care about natural health, preventative wellness, and making grounded choices for yourself or your family, today's update really matters. In this episode, we're looking at 3 important health stories from the past few days. They touch supplements, seasonal illness planning, and childhood vaccine policy. There's no fear here, no hype, just calm, clear context, so you can understand what's changing and what it means for everyday life. Let's begin. Story 1. Lead found in recalled natural capsules. Our first story involves a nationwide recall in the United States. The FDA has announced a voluntary consumer-level recall of Rheumacare Capsules, a product marketed for pain and joint support. The reason for the recall is serious. FDA testing found extremely high levels of lead, measured as high as 11,100 parts per million in certain lots. This recall was issued by Handle 9 Global Limited, doing business as NavaFresh, for products manufactured by Virgo UAP Pharma Preventative Limited. The recall applies to specific lot numbers sold in the US. Now, what's important to understand here is how this was discovered. This wasn't based on rumors or complaints alone. The FDA conducted testing and determined that the lead levels exceeded permissible safety limits. That's what triggered the recall. What this means: lead is not something the body needs in any amount. Exposure, especially repeated exposure, can affect the nervous system, kidneys, cardiovascular system, and development in children. This story matters because many people assume that herbal or traditional products are automatically safer than conventional medications. In reality, safety depends on sourcing, manufacturing standards, and quality control, not just the label. This recall does not mean all supplements are dangerous. It does mean that vigilance matters. Practical cautions. If you or someone in your household uses supplements regularly, this is a reminder to check recall notices periodically. Purchase from reputable sources. Be cautious with imported products lacking transparent testing. Anyone who has used the recalled lots, especially households with children or pregnant individuals, may want to discuss exposure concerns with a qualified healthcare professional. No panic, just awareness. Story 2. Seasonal influenza. Preparedness in India. Our second story comes from India, where public health officials are preparing for seasonal influenza. The Karnataka Health Department has issued district-level guidance tied to national surveillance planning. This follows coordination with India's National Center for Disease Control and Influenza Monitoring laboratories. The planning focuses on the January to March window, when flu cases historically rise. Districts have been instructed to strengthen testing, surveillance, and readiness. Specifically, guidance includes testing 5% of influenza-like illness samples and 100% of severe acute respiratory infection cases. Hospitals are also being asked to ensure adequate supplies, like antivirals, protective equipment, and ventilator readiness. What this means: this isn't a sign of a crisis. It's forward planning. Public health systems prepare before seasonal illness peaks, not after. What's especially relevant for everyday wellness is the emphasis on protecting high-risk groups: older adults, infants, pregnant individuals, healthcare workers, and people with compromised immunity. This type of preparation helps detect outbreaks early and reduce strain on healthcare systems. Practical cautions. For everyday people, this story is a reminder that seasonal illness is predictable. Prevention works best when it starts early. Vulnerable populations benefit most from preparedness. This does not mean everyone should assume severe illness is imminent. It means paying attention to public health guidance and responding thoughtfully as seasons change. Avoid self-prescribing medications or assuming protective equipment replaces medical care if symptoms become severe. Story 3. Possible shift in U.S. childhood vaccine recommendations. Our third story involves reported discussions at the federal level in the United States. According to reporting from Reuters and the Washington Post, U.S. health leadership is considering scaling back the number of childhood vaccines that are universally recommended. The proposed shift would move towards shared clinical decision-making, where some vaccine decisions would be made between parents and clinicians, rather than following a universal schedule. The reports note that this approach draws inspiration from Denmark's childhood immunization model, which covers fewer diseases than the current U.S. schedule. At this stage, specific vaccines have not been confirmed as changing. This is reporting on policy direction, not finalized implementation. What this means: vaccine recommendations shape how parents, clinicians, schools, and insurers operate. A move away from universal guidance could introduce more individual choice, but also more complexity. Public health experts cited in coverage caution that Denmark's healthcare system, disease patterns, and population structure differ significantly from those of the United States. Directly copying another country's schedule may not translate cleanly. This conversation is likely to continue and intensify. Practical cautions. For families, the most important thing right now is context. This is not a finalized policy change. It does not immediately alter school requirements or insurance coverage. Parents should be cautious about social media summaries and wait for official guidance from trusted medical and public health sources. Shared decision-making works best when decisions are informed, individualized, and supported by professional guidance, not rushed interpretations. Across all three stories, a common theme emerges. Health decisions, whether about supplements, seasonal illness, or childhood care, benefit from calm awareness rather than assumptions. Natural does not automatically mean safe. Preparedness does not equal panic. And policy discussions do not equal immediate change. At Earthy Cures News, our goal is to help you stay informed without fear, so you can make grounded, thoughtful choices rooted in both nature and evidence. If this kind of balanced wellness reporting matters to you, consider subscribing. And if you found today's update helpful, sharing it helps others stay informed too. Thank you for being here. We'll see you in the next Earthy Cures News update.